Thanks for joining us today. Welcome to the Center for State's video series on the essential functions for monitoring, evaluating, and applying findings. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Monitoring, Evaluating, and Applying Findings brief is intended to help child welfare agency leaders, managers, and stakeholders take a structured approach to plan for and execute strategies to monitor and evaluate implementation efforts and interventions, strategies to collect and analyze data for a variety of evaluation types, and then use that data to make decisions and plan for sustainability of programs where feasible. It does this by providing step-by-step guidance to strategize and develop a plan for evaluation, collect and analyze data and consider fidelity and costs, and then use the results to make decisions about ongoing efforts and sustainability. The Monitoring, Evaluating, and Applying Findings brief is broken down into 4 parts and 11 essential functions or tasks. It is important to remember that while the steps are presented in a linear way, in practice, often steps will overlap and be revisited as teams continue to monitor, evaluate, and apply their findings over time. Part 1 is setting the stage and includes considering the circumstances and needs of the agency, developing a logic model, identifying questions to explore, identifying the data measures, sources, and collection methods that will answer them, and then this topic, developing an evaluation plan. Part 2 is collect and analyze data, and it includes strategies to put the evaluation plan into place by collecting and analyzing the data outline, and then 2 special featured topics that are a version of data collection and analysis. They are examining fidelity and analyzing costs. Part 3 outlines how to use the data collected to make decisions and adjustments, with 2 functions on sharing findings and recommendations, and then making decisions to further spread, adjust, or discontinue. And Part 4 is on sustainability planning and how teams should refine and implement a plan to sustain interventions when this is the decision of the team and stakeholder groups. Let's get started. Why do teams need to develop an evaluation plan? Teams are encouraged to begin thinking about their evaluation plan as they develop a theory of change and select an intervention. And it's important to recognize that the evaluation plan should be integrated into the team's overall implementation plan. Teams should develop a plan to have a blueprint for evaluation activities and to clearly describe the timeframes, roles, and responsibilities for the data collection and monitoring, analyses of formative and summative evaluation data, communication and sharing of results, and decision-making on whether to further spread, adjust, or even discontinue the implementation effort. How do teams develop an evaluation plan? Teams should begin with describing the intervention and the context of the evaluation, including the intervention's purpose and goals, core components, and target population, which the team can likely pull from its implementation plan. Relevant information on the history of the intervention, prior evaluations, and existing evidence which the team likely researched during the intervention selection process. The intervention's logic model and theory of change, the purpose and objectives of the evaluation, and the plan should also describe the evaluation's scope and subcomponents. For example, a formative evaluation may include usability testing of implementation processes or evaluation tools, a fidelity assessment, and exploration of implementation processes and initial outcomes. Many considerations may shape the evaluation plan, including funding or administrative requirements, the scope and existing evidence base of the intervention, available resources, and time for data collection and analysis, and the agency and target population context. Part of developing the evaluation plan includes making decisions about the design of the study. Working with experienced evaluators can help teams make decisions about an appropriate study design that is informed by factors such as how generalizable the agency would like the conclusions to be. This will help determine the cases used in the sample. The larger and broader the sample size, the higher the likelihood that results will be more applicable in cases outside the sample. Whether to use a comparison to draw conclusions. For example, a formative evaluation looking at initial trends in short-term outcomes may assess whether parents' knowledge of child development increased after the home visits as compared with knowledge before the program started. This before and after comparison may be referred to as a pre-post test. And what measures are changing in formative evaluations? It's particularly positive changes, such as changes in family functioning or reductions in abuse reports. It's important to note that while these changes are informative to the team, they cannot connect changes specifically to the intervention. This kind of direct connection requires a more rigorous study design. More rigorous designs in summative and some formative evaluations might include an experimental or quasi-experimental design. An experimental design requires randomized assignment of participants or cases to receive a service or intervention or an alternative, and then comparisons in the outcomes are made between groups. An experimental design is often considered the gold standard of rigorous evaluation. In child welfare, it is often not feasible to randomly assign services to children and families, and teams need to consider resources and context. A good alternative can be a quasi-experimental design, which does not require randomized assignment, but uses statistical methods to create the comparisons between groups. In some cases, teams may consider non-experimental designs, such as a time series design where evaluators observe the intervention group multiple times before and after the intervention and analyze trends. A post-test only design where evaluators observe the intervention group at one point in time after the intervention, focusing particularly on comparing responses of subgroups based on such characteristics as age, sex, ethnicity, education, or level of exposure to the intervention. A goal-based evaluation model, which uses predetermined program goals and the underlying program theory, as outlined in the program logic model, as the standards for evaluation and measurement activities. And case studies, which focus on understanding the experience of program implementation within a specific context, typically relying on qualitative research. Evaluators can lead design decisions regarding these and other options with input from decision makers and program staff. Decisions may reflect the evaluation's objectives, available resources and timeframes, available samples to study, and the circumstances under which each design is most appropriate. Based on the research questions the team would like to answer, the study design, and the measurement framework identified, the evaluation plan should include the team's identified measures, data elements and data sources, how the team will train for the data collection, how the team will approach data sharing and other related agreements, as well as data transmittal, storage, security, and confidentiality, and propose data analysis methods and procedures for documenting and reporting results. The plan should also include data collection methods, tools, and procedures, and the team's decisions around what data should be collected. Teams will want to collect data that are relevant to their questions, complete, timely, and actionable. How they will collect the data. Sometimes there will be tools available, such as surveys or focus group protocols. Other times they may need to create or adapt the tools for the specific intervention and questions of interest. Teams may consider getting help from evaluators or data analysts to develop or adapt the tools they need. Who will be responsible for collecting the data? Will it be collected by external evaluators or internal staff? Who the data will be collected from? Evaluators and experts can help teams decide whether to select a sample, a representative group, or the full population receiving the intervention? And what approvals are needed? Is there a requirement for an institutional review board, or is permission from participants needed? They will also want to consider the approvals needed to store and ensure data security. All of these elements may take time, which should be accounted for in the plan. Considering these evaluation pieces early in implementation planning will help teams to capture data early and track changes over time. The plan should clearly outline the roles and responsibilities of evaluation and program staff for various evaluation activities, the agency's strategies to build capacity to evaluate, timeframes for beginning and completing preparation, data collection, analysis, and reporting, milestones and completion of key activities, as well as the submission of reports. Teams should include a high-level overview of the roles, timeframes, and milestones in their implementation plan, and should review this regularly and update it periodically as needed. Teams should also include in their plans to communicate the evaluation findings and determine how they will use the results and review them with stakeholders. A few things teams should include and integrate into their overall implementation communication plan are how they will communicate plans for the evaluation to key stakeholders, engage potential participants, including incentives for participation, report evaluation findings relevant to each stakeholder group. Different groups may have different questions they want answered by the reports or tools. For example, funders, agency leadership, or community members, and the tools and reports should address these needs. Utilize findings as a feedback loop to improve. Teams may use findings to improve the intervention and its implementation, and to make decisions about spreading, adjusting, or discontinuing the intervention. And before they finalize their evaluation plan, teams should engage stakeholders in reviewing it. This can help integrate multiple perspectives on the plan feasibility and identify any barriers or challenges and potential solutions. The cultural context of the community where the intervention is being delivered is an important detail that the team should consider as they complete their plans. The cultural context of the community will impact the processes of sharing information, interpreting data, and decisions made as a result. Teams should make an effort to learn the cultural context of program recipients and promote cultural competence in their evaluation efforts through the following strategies. Involving stakeholders throughout the evaluation process, being mindful of personal culture and biases, recognizing potential cultural implications when selecting an evaluation design, framing questions, choosing and adapting data collection tools, analyzing data, and interpreting findings, and tailoring reporting of results to stakeholder needs and encouraging the use of the findings. For example, historically, many tribes have experienced intrusive and biased research that has contributed to harmful policies and a mistrust of evaluation. Starting with building relationships, teams can work collaboratively on evaluation plans that honor cultural ways and values, tap into traditions of storytelling, and respect ownership of data and findings. Teams should review the following questions together to ensure they address these considerations in their evaluation plan. What is the purpose of the evaluation? What questions will evaluation explore? And what methods will be used to answer the questions? How frequently will data be collected? How will data be analyzed? And how will findings be communicated and by whom? What are possible challenges in conducting evaluation? And what solutions can address these challenges? And what are the costs of conducting the evaluation as specified in the plan? What resources are available to conduct the desired data collection and implement the evaluation plan? What additional supports are needed? For example, new documentation or reporting requirements, or training for data collectors. Let's take a moment to check in on what you've learned about developing an evaluation plan. Why do teams develop an evaluation plan? To have a blueprint for all evaluation activities, and to clearly outline timeframes, roles, and responsibilities for those activities. How do teams develop an evaluation plan? Teams develop a plan by describing the intervention and context, identifying the study design, data and analysis needed to complete, identifying roles and responsibilities and timeframes, engaging stakeholder groups and community members in the development and review process, and determining how to communicate all aspects of the results. What can help teams develop an evaluation plan? By considering as a team the purpose of the evaluation, the data to be collected, analyzed, and reported, and by whom, the potential challenges and solutions, as well as costs and resources available. Now take this a step further by reviewing the reflection questions for Develop an Evaluation Plan in your Monitoring, Evaluating, and Applying Findings workbook to connect what you've learned to your own experience. Up next is Collect and Analyze Data, the 7th module in this series and the first essential function in Part 2 on data collection and analysis.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P2332014000033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.